The World Health Organization Commission on Social Connection highlighted the urgent need to address loneliness and social isolation. Globally, about 1 in 6 people feel lonely, and young people feel the loneliest, and social isolation affects up to 1 in 3 older adults. Social disconnection severely impacts our health through biological, psychological, and behavioral pathways. Social prescribing provides a practical approach to strengthening social connections by linking individuals to communities, activities, and services that foster social participation and address social determinants of health. The Lancet Regional Health Western Pacific Social Prescribing Series explores how social prescribing can advance health and healthy aging across the region.
Many Western Pacific countries already implement these social prescribing-like programs even when they are not formally recognized as such. In many lower middle-income countries, community networks, cultural traditions, and informal care systems play a vital role in health and well-being. This highlights the need for adaptable frameworks rather than one-size-fits-all kind of solution. Our comprehensive mapping provides a foundation for policymakers and practitioners to design context-specific social prescribing frameworks that builds upon the strength of local cultural contexts to enhance community health and equity across the region.
Drinking green tea from a bottle while scrolling a phone. Is that the same as sharing matcha in a Japanese tea ceremony? For health, the answer is no. Epidemiology has studied many health determinants, but it often forgot culture. Culture shapes how we eat, how we move, how we connect, even how we find meaning in life. If we ignore culture, even good policies can fail. This is why we call for cultural epidemiology. By adding culture to health research, we can create health policies that are richer, closer to people's lives, and truly effective.
The relationship between art and well-being is gaining increasing attention worldwide. But what about the traditional arts and events that lies at the heart of our lives? How might these long-standing cultural practices impact people's well-being? Our recent paper, published in the Lancet Regional Health Western Pacific, explores this question through a scientific lens. We systematically reviewed global evidence and identified studies that show that rituals, festivals, daily cultural practices, and performing arts can strengthen social connections, foster emotional resilience, and enhance cultural identity. We define these practices using the UNESCO Intangible Cultural Heritage Framework and mapping them along 2 key dimensions. Our finding highlights that culture is not just a backdrop. It is a living determinant of health.
Social prescribing has often been developed in high-income countries with strong health and social systems that can identify people's needs and connect them to community services. But in our PER, we are seeing something different. Through the Connect initiative, communities themselves identify vulnerable populations and work with local authorities and health staff to find practical solutions using local resources, like improving water access and transport to clinics. This approach is about building trust and collaboration. Rather than a prescription, it's a process of co-production, which has lessons for high-income countries as well.
As the World Health Organization defines, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This reminds us that social well-being is fundamental to both health and healthy aging. Across the Western Pacific, WHO is working with relevant stakeholders, including governments, academia, civil society organizations, and citizens, to advance community-based integrated care, where social prescribing plays a key role in integrating health and social support, strengthening the social connection, addressing the social determinants of health. The Lancet Regional Health Western Pacific Social Prescribing Series celebrates this collaboration and invites everyone to help build more connected, equitable, and age-friendly societies.